Hi, this is Gloria Coppola, a licensed massage therapist, continuing education provider, and former school owner. If you're following along with this series, you know that we take a few terms each day in order for you to study and help pass your massage exams. Today, we're going to talk about some diseases of the joints. So let's look at a common one you probably have heard about, bursitis. Bursitis will tend to happen usually in a shoulder joint. It's actually an inflammation. When we think of the word itis, we want to think inflammation. Okay, so whenever you see itis at the end of a word, it always refers to some sort of inflammation. It's the inflammation of the fluid that is filled inside here. Okay, there's a sac. So there's a fluid-filled pad between the tendon and the bone, and it's called the bursa. When there's infection, trauma, or overuse, let's say a pitcher, okay, a golfer, or anybody that's doing a lot of lifting perhaps, okay, or maybe, like it says, just an infection, this particular region can become inflamed. Now, as a massage therapist, we avoid deep work on any infected area, and when it's inflamed, we don't go in on that space. We know that, right? It's a contraindication. So, bursitis, inflammation of the bursa, okay? Another one is tendonitis. Where are those tendons? Yeah, right in here, okay? So it's inflammation, because we have that word itis at the end again. Inflammation of the tendon also can be caused by infection, trauma, or overuse. So again, if I'm playing tennis and my tendons are getting overused, especially if I haven't played tennis for a while, I might develop some inflammation in here. That is tendonitis. Next word, we're going to do two more. Osteoarthritis and rheumatoid arthritis. Okay? Osteoarthritis is the most common degenerative type of joint disease. It's progressive usually in nature. It's deterioration and breakdown of the articular cartilage. So sometimes people can get osteoarthritis in different parts of their body, but it's in the joints. Okay, it can create bone spurs. They may develop at joint capsules. Okay, where it's become weakened. There could be some pain if you're weight bearing in any region, and if somebody is diagnosed with osteoarthritis, we've got to be very careful if there's inflammation as a massage therapist, and be cautious if there is bone spurs as well. So it's basically the cause is wear and tear at the joint, and it leads to the death of the chondrocytes, okay, and it becomes very thin, and there is degeneration at that articular cartilage. Osteoarthritis. We also know that if somebody has osteoarthritis, we're going to be very, very cautious by doing any deep compression moves on anybody. Okay? Rheumatoid arthritis, now it's a little different. That's a severe form of a chronic synovitis. There is that itis. Inflammation, right, you remembered. There's stiffness and pain that results from a thickening of the synovium and the projection of that synovium into the joint. Okay, inflammation of smaller joints, usually in the hands and the fingers. Sometimes you'll see, some people have it really, really bad all in their hand joints. It can affect one side or both sides of the body. Okay, and the cause of this is an autoimmune type of reaction, usually initiated by an infection. If we have a client that has rheumatoid arthritis, we avoid the affected joints when they're in an acute and inflamed state. We remember that. Always avoid when there's inflammation. Okay? So we have rheumatoid arthritis, osteoarthritis, two different types of arthritis. Remember what they are, understand them, because you might see them on your massage exam. Thank you for joining me today.